Angela Rayner, joins me now from that conference in Liverpool. Morning to you. Just wanted to get your thoughts on the fact that wages are now outstripping inflation for the first time since the start of the cost of living crisis. These new figures from the ONS, does this show that the Conservative government's working?
Well, we've had 13 years of economic failure by the Conservatives, and people can see that their cost of living has increased and there hasn't been the wage rises across the whole of the sector. Most people are still finding it incredibly difficult because their everyday bills that they can't avoid have gone up and their wages haven't kept up with that. Some areas specifically have done well, like the finance sector, but in areas like the area that I used to work in the care sector, they haven't fared so well. So we've got to, part of my speech today is about how we can have that strengthened trade unions to work collectively in partnership with employers to make sure that everybody can get a decent wage and a secure job.
Yeah, your speech today, you're talking about strengthening workers' rights and unions' rights, mass collective bargaining, a right to ignore bosses at the weekends. Some might say it sounds like Labour's going right back to the 1970s.
Well, no, this is about, we've seen, for example, P&O workers, over 800 workers who were fired and rehired. We've seen that bleeding into our economy at the moment. So people are less secure in work at the moment, and certain sectors, again, they're not seeing wage rises, but they've seen their bills increase. So this is about really making sure that everybody could do well in our economy, because that's how we'll have growth across the whole of the UK and ensure that everybody can play their part in that. And to do that, you do need strong trade unions and good employers, and you need a good state that's willing to invest in our infrastructure for the future, and that's what Labour's proposing. And we've seen it in places like Germany, where you have strong trade unions and strong employers. They have a great manufacturing base and a better performing economy because of that, and I really want to make sure that we're at the forefront internationally in creating those opportunities and those jobs for the future.
But in terms of repealing anti-union legislation, I mean, given that we've had strikes in the last few years from teachers, doctors, train drivers, nurses, public sector workers, do you really think making it even easier to strike is a vote winner for the many, many people who've been inconvenienced by these strikes?
Well, this isn't about whether it's easier not to strike in the UK. It's
about reducing the ballots that are required, isn't it?
But the problem, I'm getting to that, the problem that we've got at the moment is we've got a government that isn't working with the trade unions to end this industrial dispute. We've had nurses take industrial action for the first time ever. You don't see consultants and doctors on strike very often. This is a real crisis that has been delivered because we've had 13 years of economic and disaster from the Conservatives, and we've now got to deal with this problem because we've got vacancies, we've got an NHS that is on its knees, and the government have got no plan, whether that's an industrial strategy, whether that's the employment bill that they promised to protect workers in the workplace, or whether that's to do with our NHS. They've broken every aspect of our public services and life within Britain at the moment. We need a government that has a plan to get us in productivity again, to get growth in the economy so we can invest in our public services.
And in terms of growth in the economy, you want to look at day one employment rights. I mean, won't this discourage people from taking on new employees if employees, for example, don't have to prove themselves but could theoretically go on sick leave from day one? And some have said that potentially these plans mean that they couldn't be sacked for 2 years.
Well, let me dispel that myth, because employers can sack workers for misconduct and for absences, so that is still the case. But what you can't do is unfairly dismiss people, and that's the important bit. And employers know this and understand that if you treat your workers well and you use your procedures properly, then actually productivity goes up. You get a greater staff retention rate, so you're not having to recruit all the time and have more staff development and training. It means that actually if you invest in your workforce, then you get better productivity as well. So rights from day one is about protecting people in their workplace, ensuring they have the security going forward. But it doesn't mean that employers can't deal with misconduct or absence issues, which has always been the case and will continue to be the case.
Another of your suggestions are these fair pay agreements, that a return of collective bargaining through them. Social care, you say, is one of the industries that you really want to benefit from this. Now, this, from my experience with it, you obviously got experience with it as well. I mean, it's virtually entirely operated by the private sector, but a lot of these jobs are funded through councils, aren't they? I mean, if you're going to have higher wages across the social care sector. How on earth are councils going to be able to afford to pay these bills? We've seen Woking and Birmingham go bust already.
I mean, it is something that's close to my heart, and it's something that I did as a shop steward back when I was working in a local authority, and I worked in partnership with the employers to make sure that we had a diverse economy when it comes to the care sector, that those care workers got equal pay. They also got a training programme that meant their wages actually increased, and we were able to balance the budget as well, because it wasn't about the top line of profit, it was about providing good quality care. And if we don't do that, what happens is people end up in hospital because they're not able to get the care in the home when they need it the most, and that costs us so much more. We need to look after care workers, invest in them so that they stay in their job, that they have good training, and that we can deliver good quality care. And it saves us money because we've not got people in hospital on trolleys, which is absolutely horrendous when you think of these are the post-war generation, these are our grandparents and our parents. They shouldn't be on trolleys in the NHS costing us more when we should be able to deliver good quality care in their own homes. I know we can do this. I've done it when I was on the shop floor. We just need somebody who understands the problem and can work with the employers and the trade unions to make that happen.
But how can the councils afford to meet these bills? I mean, I'm sure everybody would like to see care workers paid more. It's a really, really tough job, and the people who do it are quite exceptional. But if councils are paying the bills and the councils can't afford to exist as they are, where's this money going to come from? Is this going to be added on for taxpayers?
Sure. Well, the challenge that we've got is we've had 13 years of the Conservatives that have slashed council budgets. So we're seeing this squeeze on council services, not just in terms of equal pay, but these squeezes on council services because the government have failed to give them long-term funding
solutions. But how would Labour sort that financial problem out? Yeah, I get that.
We will give them a long-term strategy where they can work to help with business costs, so that we can raise the money that councils can have, give them a long-term funding solution, and also things like I just said in terms of the care sector, delivering that in a way that councils want to can actually save us money. But at the moment we've got a fragmented system, we've got vacancies in the air in care, so it costs councils more money because they haven't been able to invest in the workplace and in the workforce. So even with the NHS, we've got massive vacancies at the moment. So we've got add-on costs because we're having to pay for additional agency costs, or having to pay for people to get care at the most acute stage instead of delivering it when they needed it the most. And that will save us money. So it's not always about just pumping more money in. It's about having a longer-term sustainable goal, and about making sure that the money's spent in the right places, and empowering local councils and local areas, as we've set out in our devolution plans, to really make the best of what they need locally.
OK, a couple of quick questions before we let you go. A new report out today says 1 in 3 surgeons have been assaulted by their colleagues. A real problem within the NHS. What's your view on this?
It's absolutely shocking in the NHS as well, absolutely shocking. I mean, we set out in our New Deal for Working People about how the last Labour government brought in the Equalities Act, and we want to make sure that any form of harassment at work is not tolerated. And again, that's about strengthening workers' rights, because if you feel insecure in your work, or you're not able to speak out about these issues, then it does fester, and it allows a culture where these type of extreme practices go on, and that's not acceptable. Nobody should be harassed in their workplace, and people should feel confident that they've got secure employment, that they will be listened to when they raise a concern, and that it will be acted upon. And that's what the New Deal for Working People is about. It's about empowering workers so that we can change the workplace and make it safer for everybody.
Should heads roll in the NHS if these reports are shown to be true?
Pardon, sorry, I didn't hear that.
Sorry, should heads roll in the NHS if these reports are found to be true?
Well, managers have a responsibility to create safe working environments, and the concern, whether it's the NHS or any other employer, if employees are raising concerns, or even if you're not, but you find out about this issue, then you've got a problem in a culture in your workplace. People should know their working rights, and a lot of people don't know their rights at work. They should know them. Trade unions help in delivering that to the workplace as well, and that employers have to have procedures in place to act upon it. There is law and legislation currently in place that says that kind of practice is unacceptable. The problem and the challenge we've got is this government have been allowing a culture where bad employers have been getting away with it. We will stop that and raise the standards again so people know their rights and they can exercise their rights at work, and that will make everybody safer. And those good employers that do the right thing and those good managers that do the right thing will be rewarded, and those that don't, quite frankly, they have to be dealt with.
One final thing, if I'd be really just cheeky and ask you a final question. I know you're very tight for time, but the government's talking about banning disposable vapes next week. You've described yourself to Matt Ford recently. You say that your children call you the vape dragon, but because you can't give it up. Are you worried about the impact of disposable vapes on kids? Do you wish you'd never started vaping?
Yes, I mean, I use vape to give up smoking, which is obviously, smoking is terrible, but vaping is incredibly addictive and it is nicotine. So I don't want any child, luckily my teenagers think that are pushing me to give up the vape. So they're very much in the field where I want them to be and are much more better on this than I've been. I've failed to be able to give up vape yet, but I don't want our children being subjected to vaping. This government, we brought proposals forward to end these vapes that could flavour some vapes that are clearly targeted towards children and young people, and the government voted it down. They wouldn't accept it. So I'm hearing that they're going to try and do something around disposable vapes, but to be quite honest, their actions have been failing so far. We want to ensure that vapes are used to get people off smoking as a tool, because smoking is very harmful to people's health, but we also have to ensure that our children understand that vaping is not a way forward for them. I wish I could give up vaping. I'm going to do my utmost to make sure that I do that, and young people need to know that vaping is not a way forward and they should not get addicted to it, because it is incredibly addictive and costly as well, so they need to stop.
Angela Rayner, really good to talk to you this morning. Thank you for your time. I know you've stayed a bit longer than you were meant to. Thank you.
Thank you.